What is Medicare? How is it different from group insurance? What are the different parts of it? What can you do to hold down or keep your costs low on the Medicare program? And what is Medicare Advantage? We'll answer those questions more as we dive into Medicare 101 in this video. Original Medicare. Original Medicare was started in 1965, and it's the federal program for retirees and people that suffer from certain kinds of diseases or illnesses. Now, if you're watching this video, you're probably turning 65 or you're retiring from work and you're interested in signing up for Medicare. Medicare comes in two parts. Let's get into that. So the first part of Original Medicare is Part A. Now, Part A is free for those of you who are over the age of 65 or 65 and older and have worked for at least 10 years or 40 calendar quarters and paid into the Medicare tax. Medicare Part A is not automatic though, as you do have to sign up for it when you become eligible if you want to get it. If not, you can go ahead and sign up for Medicare Part A when you sign up for Part B when you retire. Part B. Part B, on the other hand, is not free and you do have to sign up for it. Currently, as of this video, it costs $170.50 a month, and Part B covers the outpatient portions. All right, so how is Medicare different from group insurance or Affordable Care Act insurance that most people are familiar with? Well, as you can see here on this chart, Medicare covers the basic 10 essential health benefits except for maternity care and pediatrics. So basically it doesn't cover any pregnancy related services and also doesn't cover pediatrics or children. So basically most people who are on the Medicare program aren't missing out on any normal or essential health benefit. All right, so Part A. We discussed how you get Part A earlier in the video, but what actually is Part A? Well, Part A is hospital insurance, and hospital insurance is handled by a deductible. First, you have a $1,556 initial deductible. Now that $1,556 covers you when you are admitted to the hospital, and it covers you for a total of 60 days. Now, so if you get discharged from the hospital, let's say on day 10, and you go back in, let's say in the next 10 to 15 days, you don't have to repay that deductible. But if you're out of the hospital for 60 days after being admitted, then you have to refresh your deductible. Part A also covers skilled nursing care. The first 20 days of skilled nursing care is covered at zero copay, but that's typically because in order to qualify for skilled nursing home or skilled nursing facility, you actually have to have 3 days of being admitted to the hospital. And that's 3 full days of being in the hospital to have Medicare pay for a skilled nursing facility. Now, I do have a video that goes over how to fully qualify and kind of the guidelines that Medicare has for skilled nursing facility, but you can check that out in the description after completing this entire video. The last thing for Part A hospital, as far as copays go, is if you are in that hospital after 60 days, for the full 60-day term, and you end up going to the hospital for additional 30 days, so days 61 through 90, you're looking at paying about $389 per day. Now, this does change again as all these numbers change every year. We're currently looking at the 2022 numbers. If, of course, you are in the hospital for even longer than that, this doesn't happen often, but it can happen, day 91 through day 150 is actually, you are tapping into what we call lifetime reserve days. You only have 60 of them. So during this time, you're paying $788 per day, and you have 60 of these lifetime days to use. And if you exhaust them all, you're responsible for 100% of the hospital daily rate. Next on the list, we have Part B insurance. Now, Part B insurance does cost a monthly premium in addition to when you use it. Part B has 2 different types of charges. The first type is the deductible. It's a $233 annual deductible. So that's annually, not like Part A where it's per occurrence. Part B is per year. In addition to the $233 deductible, after you've met that, you'll be responsible for 20% of all the Medicare approved charges for Part B. Now, Part B allows doctors to do something called excess charge. Excess charge is a little bit confusing, but just understand that if your doctor charges excess charges, it is 15% more. So I'll go over later on in this video how to cover excess charges as with various Medigap plans. But just for now, know that those are the three major areas that Medicare Part B has financial responsibility for you. Now, how is this different from my group insurance? How much does my group insurance cost? Well, I did a comparison here and I used a 64-year-old female in the state of Hawaii. Now, a gold plan is very similar to Medicare Parts A and B, as a gold plan is a plan that has 80-20 cost share. What that means is for most services, you will pay 20%, just like on Medicare Part B, and typically you have a deductible. Now, one of the plans here does not have a deductible, but it does cost a little bit more per month. So the cost for these plans for a 64-year-old female who takes no medications and who only goes to the doctor twice a year is about $1,000 per month. They estimate by the estimation tool that we have here that someone who utilizes 2 doctor visits a year and has no medications costs about $14,000 a year. Now, in this next couple of slides, I'll go over and show you how a Medicare Supplement Plan or a Medigap plan can actually cost you half, less than half, of what the all-in costs for regular coverage, and how you actually will have better coverage than you would have had on the ACA plans. So once you enroll in the Medicare Part A and B program, you have 2 choices. We're going to go and talk about the first choice here, which is the original Medicare Parts A and B, which we just went over, purchasing a Medicare Supplement Plan or a Medigap plan, and then a separate Part D. But the separate Part D will wait until the end when we discuss both Medicare Advantage and Medicare Supplements, so that you don't get confused, as Medicare Supplements really only work with Parts A and B. What is the cost on original Medicare? Well, if you look here in this study done in 2018 for a 65-year-old female, we find out that if someone is worst case scenario, they're looking at paying $20,000 a year for Medicare related services. Now, other graphs here you can see do smooth out that cost for people who are extremely sick, Plan F and Plan N. Unfortunately, we don't have a comparison on what Plan G would cost, as Plan F is no longer available for people who are turning 65 now. But you can see it's probably going to be a little bit around the same, as a Plan G is actually a little bit more cost effective than a Plan F. So how do we stop, or how do we cap those huge copays that Medicare Parts A and Parts B have for their services? Well, we get a Medicare Supplement Plan. What is a Medicare Supplement Plan? Well, Medicare Supplement Plan caps the financial risk, the monetary risk that you have to pay for services covered under Parts A and Parts B. It allows you to see any provider who accepts original Medicare across the US. You don't have any networks. You also have very utilization management, which means that your services that you require, the medical services that you require, so long as they are covered by Medicare, you yourself don't have to worry about getting too much prior authorizations done. Now, some of the Medicare services do require prior authorizations, but far less than Medicare Advantage. And you'll see that when I go into Medicare Advantage. Another benefit of Medicare supplement plans is that they are federally standardized, which means that a Plan G from Company A is exactly the same as a Plan G from Company B. Now, with all these different letters, there are 10, which one should I look at first? Or which one should I be concerned with? Well, fortunately, I really only talk about 2 of them. They're the only 2 that make the most sense to me, both financially and when it comes to figuring out how to figure out your own copay. Because other than that, a lot of them are pretty confusing. So we're going to talk about Plan N and Plan G. What does Plan G cover? Well, as you can see on this chart here, these are the 3 gaps from Medicare Part A and the 3 gaps from Medicare Part B. These are the financial gaps that you have to worry about, and they're your responsibility when you utilize these services. On Part A, it's at $1,556 deductible, the day 61 through 90, day 91 through 150, and of course, day 20 and day 21 and beyond for skilled nursing care. Now on Part B, you're looking at the annual deductible, the 20% co-insurance that you are responsible for, and excess charges. As you can see on this list, the highlighted portion is what Plan G pays for, and the red is what you are responsible for. So on a Plan G, you're only responsible for the Part B deductible. Everything else that is a Medicare covered service, you owe no copay for. Pretty good, huh? Now let's take a look at Plan N. So Plan N is very similar to Plan G, except on the Part B portion of Medicare. Plan N doesn't cover excess charges, and when you go to the doctor's office, you are required to pay up to a $20 copay, and at the ER, you're required to pay up to a $50 copay if you're not admitted to the hospital, because under Part A with Plan N, you are covered 100% for all the Part A financial gaps. Now, how is this relevant? How does this affect me? Now, a lot of my clients ask how Medicare covers cancer. Is that a concern? Many of my clients have unfortunately had cancer, and some of my friends and my fellow agents also have battled with cancer. So, if you can see in this study here, Tom, who is on Medicare and has a Medicare Plan F and a Medicare Part D plan, his cancer services came out to a little over $124,000. Fortunately, with Medicare, Medicare Plan F, and a Part D plan, his out-of-pocket responsibility was less than about $1,500. I believe it was $1,300 in some odd cents. So Medicare with a Plan F and a Part D plan is pretty powerful. Now, what can you get since Plan F is no longer there? Well, a Plan G and a Plan N would be pretty suitable for you and would definitely cap your costs so that you're not paying that ridiculous $124,000. Now, cancer is something that Medicare doesn't cover well, especially now moving into 2022, as much of the cancer treatments are being moved to Part D, meaning that a lot of the cancer medications that you take at home from a pharmacist. Now, I'll go into a little bit later when we talk about Part D, but keep that in mind if cancer is one of your major concerns. Next on the Medicare coverage choices, we have Medicare Advantage or Part C. Now, this is an alternative to Medicare Part A and B, so you are kind of saying, all right, federal government, I would like this company instead to manage my Part A and B benefits, and I will give up the freedom and flexibility to see any provider I want across the US in exchange for the benefits that this company is giving me. So, Medicare Advantage. Part C replaces A and B, and Part C can also include a Part D plan, and drugs can be included in there. And if you do sign up for Medicare Advantage plan and you need drugs, you will have to get the drug plan that is included with the Medicare Advantage plan. So you can't choose that MA only or Medicare Advantage with no drug plans. You will need to get a Part C that has drugs attached to it, or you will face a penalty. Now, this is, of course, unless you have drug coverage elsewhere, like through an employer or through the VA or through TRICARE. But for most folks, if you sign up for a Medicare Advantage plan, you will need to have drugs included. Medicare Advantage plans are governed by the Medicare Advantage company, a private insurance company that you sign up for. What that means is these companies can deny services and have restrictions on providers and services that you use. In addition, these plans can change every year, and they do. And also their structure is either a PPO or an HMO typically. So the problems of Medicare Advantage. Now, I know there's lots of commercials out there. They're the ones that are running the commercials for the free drug plan, the free dental, free gym membership, zero premium plan, unlock your Medicare benefits. Now, all that comes at a cost. Remember, Medicare Advantage companies are privately run companies that do have to generate a profit. So, how are Medicare Advantage plans different, and how do I see that the research shows that they have problems? First, the Office of Inspector General in their reports have found that Medicare Advantage plans make inappropriate decisions when it comes to medical attention needed for their members. You can see here, this audit shows that the problems are widespread when it comes to denials of care and payments in Medicare Advantage plans. There are insufficient denial letters, inappropriate determinations, and inappropriate or wrong clinical decisions when it comes to their members' care. This can be really problematic, as you can see on this chart here, Kaiser Family Foundation research has shown that Medicare Advantage plans have prior authorizations on 80% of the services that they give out. Even for preventative services down here, about 12% of Medicare Advantage plans need you to get prior approval to even have preventative services done. In addition, 45% of these audited companies, these Medicare Advantage organizations, did have problems with providing insufficient information when it comes to denial letters. Also, interestingly, only 1% of any of these denials were ever contested. Just take a look at this chart here, or this appeals process, where if you have an appeal that you want to send to the Medicare Advantage company, there are actually 4 levels of appeals that you have to go through before you can actually get a good decision. So many physicians and patients do not even try because the process is just so difficult. Plus there's timelines that they have to abide by, and all the bureaucracy that comes when it comes to appealing anything with a government body. And to make matters worse, as you can see in this article, this gentleman unfortunately found out that his Medicare Advantage costs were really high, but even if he were to get out of the Medicare Advantage plans, they'd be even higher. As we talked about before in the Medicare Supplement Program, why you need a Medicare Supplement plan, because the costs on original Medicare would be even greater. And unlike Medicare Advantage, where you can switch companies every year, if you do not sign for a Medicare Supplement plan when you have to, you may not be able to qualify, especially when you are in need of care. You can see my video on when to sign up for Medicare or a Medigap plan here in the link down below, and of course after you watch this video. So why is that? Well, of course, Medicare Advantage companies are privately held and run, sometimes publicly traded, so they have to generate a profit. Now, as you can see here on this chart, this graph that this wonderful professor over in New York has prepared, Medicare's overhead costs are only about 2%, while the private company's costs can range all the way up to 17%, 17.8% with United Healthcare. And in addition to that, MedPAC, which does an annual audit of Medicare Advantage plans, has shown here that since its inception in 2004, Medicare Advantage plans has never saved CMS money. The bottom line on that graph is what fee-for-service traditional original Medicare Parts A and B cost, and that line up on the top shows the additional spending that's required to operate and run Medicare Advantage programs. Now, in this little summary that the same MedPAC group has discovered is that fee-for-service has unrestricted provider networks and less utilization management, while Medicare Advantage has reduced cost sharing and other supplemental benefits. Given the historically high level of extra benefits in Medicare Advantage, is the trade-off appropriately balanced? And the study goes on to further find that they need to have a better way to benchmark these programs, because right now it's like comparing apples to oranges. It's not the same. And that should speak volumes for you folks who are coming into the program, because you have a choice. You can either choose between clear-cut, defined treatment and protocols, or you can join a Medicare Advantage plan and potentially have problems with prior authorizations and denials. Now, if you're someone who keeps track of all their records and is a good record keeper and can go on the phone and battle with the insurance company, Medicare Advantage may work for you. It is something that can get you better or more, with quotes, more benefits than the original Medicare program. It does have dental, vision, gym membership. Sometimes there's additional benefits for joining. But you are taking on additional risk that you cannot control. So that's something you have to think about. It is a trade-off between Medicare Advantage or staying with the original Medicare program and buying a Medicare supplement plan. Now, Medicare supplement plans aren't angels either. Their rates can rise every year, as the cost of all medical insurance can. If any of you own long-term care insurance, you know Medicare medical insurance does have built-in inflation, so every year it goes up anywhere between 5 to 8%. And of course, these are age-rated policies, so as you advance in age, they can and tend to get more expensive. So it is a trade-off, and it does depend on how you want your services and your care to go. So here are the things that Parts A and B don't cover. dental, vision, hearing. So if you have a Medicare Supplement plan, you need to get these things. In addition to that, prescription drugs are also not covered under A and B. They might be added to your plan if you sign up for Medicare Part C plan, but they're not covered. Additionally, skilled nursing facility for long-term care is also not covered under Medicare. So first, let's do the Part D prescription drug plan, because that is going to take another 5 minutes. All right, Part D, let's go. So prescription drug plans. These plans vary between counties. They're offered only by private insurance companies, so you have to go through them to get it. And they change every year. Also, if you have a Part D penalty because you enrolled late, that penalty will follow you no matter which Part D plan you sign up for. And it's not based on the Part D you sign up for's price. It's actually based off the national Part D average. And that changes, of course, every year. So it makes it a little bit more complicated. Now let's go into how Medicare Part D's payment structure works, because that also can be confusing. So let's take a look at Medicare Part D and how the coverage works. Initially, you have a premium. That's a monthly premium you have to pay every month for the plan. Next, when you get services or when you get medicine from the pharmacy, not services, Medicare Part D doesn't cover services, only the medicine you pick up from pharmacies. When you first go for the first fill, you may have an annual deductible. The annual deductible can be as high as $480 in 2022. Now that number goes up every year as well. If you have to pay a deductible, after your deductible is paid for, you go into what's called the initial coverage stage. And during this stage, you have the printed and advertised copays that the plan came with. Next, once you reach the coverage gap, which you can see on this slide here, in 2022, the coverage gap begins when you and your drug plan have spent $4,430. Now, from that point on, you will be responsible for 25% of the generic drugs cost and 25% of the brand name drug cost. But 95% of that cost counts towards your out-of-pocket. So the gap is between 4,430 and 7,050. Because at $7,050, you go into the catastrophic phase where now your drug copays are 5% of the drug cost. I know it's confusing. The only way to really plan for this is to run your medications through our plan finder every year to find out which one's going to save you the most money, because in actuality, it's really hard to gauge, and it's one of the problems that Medicare has. Now, Medicare has recently put into legislation, or at least on the table to be talked about, they're considering putting a cap on Medicare Part D spending, but as of right now, there is nothing in writing, and of course nothing on how they would fund something like that, because right now Medicare Part D is very expensive for both the government and for beneficiaries on Medicare. So the coverage gap is terrible. If you need to learn more about the coverage gap, you can check out a video I did down in the links down below, or go back a little bit and listen to that thing again. I do a much better explanation on my video for Medicare Part D, which you can see after this video in the description below. But why should you even be concerned if you take no medications? Well, you shouldn't. And what you should do if you take no medications is sign up for the lowest expensive plan in your area that supports the pharmacies that you may go to. But if you're on medication, you should review these things annually, because if you don't, as you can see on this list here, depending on their drug coverage, the cost of the same medication across different drug plans can be as much as $100. And it doesn't cost you anything to call up my office, send me an email, and ask for a consultation during AEP, or the annual election period. Now, what are the glaring costs on Part D? Part D is also not perfect. We went through how Medicare supplements aren't perfect, Medicare Advantage not perfect, and Part D is not perfect either. Part D is not perfect because certain medications, as you can see on this graph here, can and will range up to $16,000 even with adequate Part D coverage. Now, I wouldn't consider that adequate, but that's the gist of it. And most of those drugs on that higher end of the tier are for cancer. So again, we found out a good way to cover cancer with the Plan F and the Part D plan. Remember Tom, back that cancer patient who would have paid $124,000 if he didn't have any insurance, but thanks to Medicare and his Medicare Supplement Plan, the Part D plan, he paid only about $1,400. Now it looks like he might have had to pay $16,000 because of the way that Medicare now handles cancer. They have most of the medications you take at home. So what can you do to prevent or to protect yourself from that? I usually suggest people get what's called cancer insurance. And cancer insurance is when you get diagnosed with cancer, you get quick $20,000 or $10,000 depending on the plan you buy. And what that does is it helps you purchase those Part D medications that can be up to $16,000. Now, if you've had cancer in the past 5 to 10 years, you may not be able to qualify for this type of plan, but if you are interested, please do let me know. I usually build it into all of my Medicare analysis. So if you are my client or you are working with me currently, you will have that already pre-programmed in. Now, long-term care. I know most of you think, of course, Medicare is not going to pay for long-term care, but they also have very strict guidelines on how they pay for skilled nursing facility care. So what I do now is I build into as well a short-term care policy which can cover you when you get out of the hospital so that you can go in to skilled nursing home without dealing with Medicare. Now, Medicare is obviously the more smart way if you can abide by all their guidelines to go to the nursing home. Of course, that's the best way to do it as they provide you with 20 free days. But if you can't, or if you need to stay longer than those 20 free days, short-term care policies will be able to help you stay either in the nursing home or get help around the house. As you can see on this little comparison here, what skilled care versus custodial care is from CMS, the people who administer Medicare Part A. It is very different, and sometimes people do need help beyond their stay at the skilled nursing home, and a short-term care policy will be able to supplement your income so that you can actually pay for the custodial care to help you get better. Now, short-term care is never going to replace a long-term care policy, so if you wanted to learn more about those types of things, please let me know in an email, and then I can go and research what would be something that you can afford. I would need to know your budget and a little bit more about your health condition so that I can find the best product out there though. And that is, of course, if your financial professional didn't already provide you with options. If you don't have a financial professional you are working with, I specialize primarily in retirement planning and long-term care, as well as Medicare. So I would be able to at least go over options that you might have so that you can have a more smooth transition into retirement. All right, so here's the fun part. How much does all of this cost? Okay, so Medicare Supplement plans, as you can see here, for a 65-year-old female turning 65 going onto the Medicare program, this is what a Medicare Supplement full coverage would look like. For about $473.70 a month, you have your original Medicare, Medicare Supplement Plan G, a Part D drug plan, a dental discount program, a cancer plan, and the short-term care plan. And this would cover all the Medicare basics as well as cover those things that are outliers that may come into play or may be a big risk for people on Medicare. Now, with this plan, Medicare Part A and B covered services would only cost you $233 for the whole year, as that's the only portion of the Medicare copays that you are responsible for under the Plan G. Now, you could save a little bit of money by choosing a Plan N. The Plan G and Plan N savings is anywhere between $20 to $40 per month. So if that is something that is meaningful to you, that $20 to $40 in savings, and you are willing to take on the additional risk of excess charges and the $20 copay at the doctor or the $50 copay at the ER, that might be in your best interest. So what about Medicare Advantage? Now, Medicare Advantage, I'm going to put a little asterisk here, as I normally don't recommend people to do Medicare Advantage until they have accepted all the problems with it. And also, I would not recommend someone do Medicare Advantage unless they actually purchase cancer insurance, because Medicare Advantage programs, in addition to the chemotherapy treatments and infusions that would cost you 20%, you still have the Part D drug plan problem. So let's get into Medicare Advantage. For Medicare Advantage coverage, $436.50 per month, and that's, of course, you still have to pay your A and B premium. A good PPO Medicare Advantage plan, I usually only talk about PPOs, is about $56 per month. You don't have to pay for a drug plan because that is included. I added here a dental discount program because a lot of the Medicare Advantage plans do not have sufficient dental. A cancer plan for a little bit more benefits because you will have to pay, you could potentially have to pay the maximum out of pocket on your Medicare Advantage plan twice, because if the cancer is later in the year, your maximum out of pocket will refresh, unfortunately, and you have to pay that whole $5,350 again. So I built in an additional about $10,000 of cancer coverage. And of course, the short-term care plan, I added a little bit more because Medicare Advantage plans are infamous for not approving any skilled nursing care home. So I would say that you need a little bit more short-term care policy and a little bit bigger cancer policy to make the Medicare Advantage plan work. This plan would cover all the Medicare basics, provide additional membership benefits like gym membership, wellness rewards, predictable premiums, and unfortunately, you'd still be accustomed to the Medicare gaps. You would have restricted networks and the insurance service denial. So for Medicare Advantage folks, be sure you keep those things in mind, as that can be something you can avoid simply by choosing a Medicare supplement plan. And the cost difference as far as how I cost things out as far as risk, Medicare supplement plans are a little bit more expensive, but your risk that you're taking on is much less. So which way is better, right? For me, I always start off with Medicare supplement plans because I believe that that is the more advantageous way to get coverage when you're on the Medicare program. But for some people who can't afford perhaps a $450 or $480 per month medical premium expense, Medicare Advantage does have its place in certain areas. You can get zero premium Medicare Advantage plans if you like the network, if you have a great relationship with your doctor. You can watch more about my video on Medicare Supplement versus Medicare Advantage down in the description below, but I think I covered it pretty well in this video. Also, for any more deeper dive into any of the particular topics that we talked about in this longer Medicare 101 video, you can either let me know, I can provide you with the resources, or you can click down below, as all the resources are in the description. And most of my videos do kind of talk in depth about certain things, but if I miss something, or if there is a particular question that you just can't seem to find the answer on, let me know. I'll do my best to do my research and let you know what I find. I'll see you in the next video, and also be sure to let me know any questions you have. If you are working with me, I need to know as much information as I can so that I can provide you with the best analysis for you. I'll see you guys later.